occurs during second hour after meal. It lasts for 30 to 40 minutes and it is relieved by lying down. That is your late dumping syndrome. So this statement, major symptoms are tremor, faintness and prostration that are for early dumping. Which one of the following statement is not correct regarding gastric outlets associated with long-standing peptic ulcer disease? So the correct answer is C. Medical therapy has no role in the treatment of this condition. That is the wrong statement. Let's see the right statements. In gastric outlet obstruction with long-standing peptic ulcer, you will see reduced chloride alkalosis in the usual metabolic abnormality. Endoscopic biopsy is essential to exclude malignancy. Operation is frequently required along with a drainage procedure, but medical therapy does have some role. The commonly used muscle relaxant with quickest onset of action and spontaneous recovery is your atracurium because of the Hoffman animation. The first imaging modality of choice for a 35-year-old lady presenting to surgical emergency with complaints of colicky pain in the right lower quadrant of abdomen and vomiting since last 2 days. We are suspecting appendicitis. First investigation of choice will be obviously your ultrasound abdomen. That is the first test. Investigation of choice, if they ask, then it is contrast CT abdomen. Malampati score test is used for the assessment of airway. Consider the following. Which of the following are the risk factors for post-operative wound dehiscence? So the correct answer is C. So C is your diabetes, renal failure and jaundice. So according to this paper, hypertension is not a risk factor for wound dehiscence. If faced with a surgical emergency in a child of 15 years for whom no consent is available for life-saving surgery and no time for seeking authority from someone, the next step should be go ahead with surgery without consent. That is the correct answer. You can do the surgery without any kind of consent because it is an emergency life-saving procedure. Which of the following information needs to be disclosed in order to establish valid consent for surgical treatment? The answer is A. So you need condition and reasons why it warrants surgery, types of surgery proposed, and unexpected hazards of proposed surgery. This is the information that needs to be disclosed in the valid consent for surgical treatment. What you don't see there is the surgical experience and expertise of the operating surgeon. A surgical department of Premier Medical College conducted a study on rates of post-operative wound infection. The results of the study were negative for the proposed hypothesis. What should the department do with the results? The answer is A. The answer of question 9 is C. C for cat. Report the negative results. So if you're getting negative results, then you have to report them as well. Which of the following statements are correct regarding sutures in surgery? Let's read. Barbed sutures have the advantages of eliminating the need for knots. Vertical mattress sutures help in eversion of wound edges. A burden knot is used for continuous suturing. Silk is preferred for subcuticular suturing. So the correct answer here is A. So your wrong statement is 4. Silk is preferred for subcuticle suturing. Actually, silk is used for skin suturing. So the other 3 statements are correct. That is barbed suture, no knots, vertical mattress, eversion, a burden knot, continuous suturing. Going to 11. The most common site of urethral opening in cases of hypospadias is, it is just proximal to the glands. That is the most common. Which of the following minimal access surgery are correct? Decrease intraoperative heat loss, improved visualization, increased chances of herniation, improved mobility. So the correct statement here is D. 1, 2 and 4. Those are the correct statements. So your wrong one is 3, that is increased chance of herniation. Minimum access surgery does not increase the chances of herniation, but it does provide decreased heat loss, increased visualization and mobility. The maximum safe dose for lignocaine without adrenaline as a local anesthetic is 5 mg per kg. 5 mg per kg. Which of the following are the symptoms commonly experienced by patients with lymphedema? Let's see the swelling, burning sensation, intolerance to cold, cramps. Correct answer is A, 1, 2 and 4. So intolerance to cold is not seen here, it is seen in hypothyroidism. So your swelling, burning and cramps can be seen in lymphedema, and instead these patients are heat sensitive. They cannot tolerate heat in lymphedema. Which of the following are malignancies associated with lymphedema? Your correct answer is A, that is Kaposi sarcoma, squamous cell carcinoma and leukemia. All these are associated with your lymphedema, but malignant melanoma is not associated. It is Kaposi's, SCC and leukemia. Going to 16. Which of the following are the technique commonly used to close the raw area after excision of pilonidal sinus in order to avoid a midline wound? Correct answer is B. The techniques used to avoid a midline wound is Limburg, YV-plasty and Keridaki's procedure. So Z-plasty is not the answer here. Z-plasty is not the answer. It would be Limburg, YV-plasty and Keridaki's procedure. A 45-year-old lady presents with history of painless lump in the right breast since 1 month. On examination, so there is a painless lump in the right breast since 1 month. On examination, the lump is hard, 3 by 4 centimeters in size in the upper quadrant and is not fixed to the skin or the underlying structures. The axilla reveals firm, mobile lymph nodes. Rest of systemic examinations is normal. What is the clinical stage? It is clinical stage T3N1 because it is still less than 5 centimeters, so it's T3, and the nodes are still mobile, so it's N1. The correct answer here is B, sorry, T2N1. It would be T2, not T3, because the size is 3 by 4 centimeters. If it is more than 5, then it goes in 3. Which of the following is considered the gold standard for the diagnosis of esophageal motility disorders? So the gold standard would be high resolution manometry. For conditions like achalasia and diffuse esophageal spasm, you will go for high resolution manometry. Which of the following are considered etiological factors for adenocarcinoma esophagus? So here, except alcohol, all are risk factors. So Barrett's, reflux, obesity, everything. But alcohol intake will give you a SCC, squamous cell carcinoma. Consider the following statement regarding Plummer-Wilson syndrome. The correct answer is all except the 4. So what are the correct statements? Findings include cervical, esophageal web, iron deficiency anemia, and dysphagia. It is a rare disease mainly affecting middle-aged women. There is a predisposition to post-cricoid cervical esophageal cancer. But treatment is not surgical, it is iron supplements. Okay, going to next. The commonest site of pressure sore is ischium, not sacrum, it is ischium. Resection of which part of intestine does not significantly affect fluid and electrolyte balance? That would be your colon. Good measure of systemic perfusion by ABG is by measurement of lactate and base deficit. How do you check for systemic perfusion? By lactate or base deficit. Which of the following are congenital abnormalities of the gallbladder? So the options are Phrygian cap, floating gallbladder, absence of gallbladder, Spigelian gallbladder. So you need to know the names. Here all are congenital except for that is Spigelian gallbladder. So Phrygian gap, floating gallbladder, and absence of gallbladder are congenital problems. Which of the following are functions of the gallbladder?